In cases where an injury to the head is observed, it is important to document the event in addition to reporting it to a supervisor and the parents. Routine documentation of incidents, which include a thorough description of individual events as well as the child's reactions, will be helpful in charting head injuries. This information will assist medical professionals in making a diagnosis of brain injury and guiding its treatment.
So in diagnosing children and adults that have mild traumatic brain injury, a key issue is the history. If you don't have a good history, it's very difficult to make some final decisions.
How was the head moved? Was it moved violently from side to side? Did they hit the ground? Did they hit something else? Did they have a helmet? How was it moved? Because that will help us to understand a lot what to look for in terms of neuropsychological assessments in the future and maybe imaging.
If a child is laying there unconscious for an extended period of time, say more than a minute, I would be going to the ER with that child. I wouldn't go to the PCP. If the child has an injury beyond just a cut that needs a few stitches, I'd be going to the ER.
Certainly if the baby is turning blue or in a coma or seizing, you want to call 911 immediately.
The American Academy of Pediatrics recommends closely monitoring a child for 24 to 48 hours and up to several days after a head injury. Although the child may seem normal or complain of a headache, there may be a slow bleed within the brain or under the skull, which over time can increase pressure within the brain. If untreated, these complications can be life-threatening or result in permanent disabilities. If the child's condition worsens at any time during the interval of observation, parents, guardians, or caregivers should seek immediate medical attention. If a traumatic brain injury was not observed but is suspected, it's important to document observations, notify parents of these changes, and ask questions that would establish a history of head injury. Did anything happen that might have caused a blow to the head? Was there a car accident? A fall off a bed, playground equipment, or downstairs? A fight with a playmate or a sibling? Was there any incident that led to a disruption in consciousness or period of confusion?
2 is one of the huge milestones for language development, and if you're not seeing language develop at that time, then there needs to be an evaluation done. It's difficult sometimes to question parents, but if you question them in a way that is trying to understand how best to help their child and make sure the child gets the needs that's best for them, then you can work with the parent instead of work against the parent. Parents will either tell you exactly what happened, or most cases they'll say they fell off of the bed, they were climbing on something, they fell. So at least the report begins to have what's called a paper trail. And that paper trail then helps you begin to piece together whether or not a crime has occurred or whether or not there's more need for more severe interventions.
It's very important to document these things and make the information available to the parents and suggest that they probably need to have the baby checked out by a medical provider. If these conditions persist over a period of time or even get worse and can result in a life-threatening kind of situation, it's time to take them to a different level and call medical authorities or someone at a higher level.
In cases of non-accidental trauma, it is essential to follow the reporting requirements set forth by your Head Start facility and state child protection agency to ensure the safety of the child and avoid placement back into a situation where additional harm can occur.